So basically, this is my team, the blood health team. So this is what we're in place for. And like I said, we also manage the delivery of leaflets within the local health boards. We host them on our website and we also send them out as hard copy. Okay, so this is what I was talking about in terms of the National Comparative Audit and the medical use of red cells. So what we found was that 56% actually said that they did not discuss the benefits, risks and alternatives of transfusion with their patients. And that's people that are authorising blood. That's all healthcare professionals, including doctors and nurses. Okay, so what we decided to do as part of the Bevan project then, we did, prior to undertaking the project, we did a survey of our F1 junior doctors. So we asked them a number of questions as a result of the NCA audit. And one of them was, were they aware of the blood transfusion leaflet, will I need a blood transfusion, that we host? 86% said they were aware of it, 14% said they were not. We do a junior doctor training session, so that might be why the majority were aware of it, and that's only in Wales. So we also asked, will I need a blood transfusion leaflet? Do you use it during the consent process? So considering how many were aware of it, actually half said they do not use it. A few reasons that were given as a result of this was that they didn't feel confident asking if a patient asked them questions, didn't feel confident to answer the questions. As we know, consent is hot on the agenda at the moment, and it is an ongoing process. So gone are the days where we used to assume consent or give one leaflet for people to read, you know, as part of the initial consultation process. We're now using consent as an ongoing process. So everybody that sees the patient should be checking that they understand what is happening, what treatments they're going to receive. So we have good practice guidance within transfusion, and these are SABTO. So SABTO is the safety of tissues, of blood, tissues and organs. So it's a committee that looks after that. And then we've got the GMC decision making and consent guidelines, which were come out in 2011 and now have been reviewed in 2020. We've got the NICE blood transfusion guidelines and quality standards, and also a big emphasis of consent has come from the case law and the inquiries such as Lanarkshire and Montgomery. We've also got an ongoing infected blood inquiry, which we have preempted recommendations which are going to be about the information we provide in terms of consent. So what we wanted to find out then was, does a single patient resource really support informed consent for blood transfusion? Currently, what we provide is a single patient resource, which is a trifold leaflet, which is a lot of text on, and we also provide a web page leaflet, which can be printable. Approximately 61% of adults in the UK are unable to read and comprehend current health literature in a text-based format, a large percentage really of the population. This has come from the Patient Information Forum report making the case for information. This opened our eyes to what we needed to do. We were going to review the current WBS patient information leaflet, will I need a blood transfusion? So it was quite timely really. So we wanted to look at how we could maximise access to transfusion-based information sources and make sure that they were accessible to everybody. The PIF also states that low health literacy information must be provided in a range of different formats. What we currently had was not supporting this, so we wanted to change. So as part of the Exemplar project summary, just a little overview of how this project took place and the lifetime of the project. We had an initiation and approval process in 2018. We did a review of our patient information resources, and this is where the idea came from. We then took the idea that we wanted to change and look at alternative formats to the WBS executive team for approval. Once we were granted approval, then we put a Bevan application in, and our Bevan exemplar was accepted. We did the F1 survey to junior doctors, which is where we've got some of our data. Some of the influencing factors over the lifetime of this project has been that SABTO put the review of patient consent out in 2020, and also the GMP guidance came out in 2020. So they haven't had a massive impact, but they've helped us in terms of looking at what we wanted to achieve as part of this project. As with everybody else, COVID-19 struck, and this was an engagement project, so it had a massive impact on the way that we were going to outline how and achieve our aims of this project. One of the ideas that we had for the project was that we wanted to do engagement through forums. So set up a clinical forum with clinicians and nurses, doctors, and also do a patient or public participation forum. Obviously, we couldn't get people in a room to do that, so that was a bit of an issue. And I'll talk about that in a bit. Then we've got the execution of the project. So what we decided to do instead was to send out a survey. Not ideal, but actually we did gain quite a lot of really good information and feedback as a result of this survey. The problem was trying to get people to engage with the survey. So what we did was we contacted our engagement team within Velindre NHS Trust, who hosts us as a Welsh Blood service. Basically, we asked them if they could help us by giving us their contacts and networks within the local health boards. We had a really good response. I had a number of meetings, especially with Cardiff and Vale, Betsy Cadwala. We had a really good response all across Wales and the local health boards who were willing to share our survey within their networks. As a result, we had about 35 responses, which was a good number of responses to undertake our survey, looking at and reviewing the way the information is presented as forms of a trifold leaflet. So we did a lot of collaboration and partnership working as a result and through the feedback. The work is still ongoing. It hasn't by no means been completed and closed out. We're still looking at the other 11 or 12 leaflets that we've got in place at the moment. And that is something that we hope to continue working on over the next possibly 2 years. We're going to set out a further survey and engagement, and we hope to, once COVID hopefully has gone, we hope, look at the clinical review group to be established. Obviously, other people have priorities in the clinical arena at the moment, larger priorities than this. So the qualitative data then, the public or patient survey, some of the comments that were made were, so this is our trifold leaflet in the centre, will I need a blood transfusion? They are very difficult to read. I would prefer an audio version and an electronic version. That is our electronic version, which is printable, but still that wasn't acceptable really. I am sight impaired and the print is very difficult to read. There are too many reading options and they're not suitable for adults with learning disabilities. So this was a biggie for us as well, because what we wanted to do is make it inclusive to everybody. And it's very important that we cover off all the populations in Wales as well. Survey results as part of the F1 survey, we wanted to look at the accessibility issues that we were having as well. So preference to receive information. 59% of people said that they would prefer to receive the information prior to consultation, which meant perhaps accessibility through web pages, because they would obviously go and find that information themselves. 41% said they would need it at initial consultation. And what we were finding were that some of our healthcare professionals said that they didn't have the information to hand when they needed it. So that was also an issue in terms of accessibility. Another biggie for us was 72% of people said they would prefer an easy read leaflet. And a number of people that I've spoke to anecdotally, whether they have a high health literacy or not, have said that actually, do you know what, I would prefer to be able to read something, but also see the pictures of it as well. So that was quite a big issue for us. And also 20% said they would like real life patient stories. So that's another thing that we're going to be looking at later on down the line. So in order to address the issue of low health literacy, the fact that people wanted an easy read leaflet, what we did as part of this project was get together with Vale People First and Cardiff People First to produce a leaflet that was going to be appropriate. This one on screen is actually our first draft of the leaflet, and it has been produced mostly by people within Vale People First and Cardiff People First, who are of the learning disability population. So they helped us to produce this leaflet. We also had an input into the leaflet itself as well, but it was a really good partnership working, and hopefully something that we intend to continue longer term. So this was to the F1 doctors. Would you use patient information leaflets if they were available in alternative formats? 52% said they would. 39% said no, so that needs to be looked at in more depth, and possibly another engagement project with the clinician. So that will be part of the clinician group later on down the line. So our key outcomes of this project, it's all about informed decision making, making sure that it's inclusive. I'd seen a lovely presentation on here a couple of days back, I think it was Wednesday, which looked at conversational leadership. And I think this is something, a big part of what we wanted to do as well. So we wanted our healthcare professionals who could authorise blood to be able to sit down with a patient and have these conversations, but have the information and support provided then and there, so that they were able to have these conversations and that their patients would understand what they were talking about in terms of blood transfusions. So we wanted to make it inclusive, we wanted to make it personalised. We wanted to support shared decision making, and this is something that we've done, and to take a prudent approach of co-production, because that was one of the main aims of this project. We wanted to work in partnership with populations in Wales to make sure they were getting what they needed in terms of information. So again, in terms of co-production, remodelling the relationship between the user and provider on the basis of co-production, allowing those conversations and allowing for shared decision making to occur. We also wanted to make sure they were accessible at point of delivery need, because this was a big issue. So we wanted to look at new technology. Now, we went to the health hack with the Bevan. Our initial idea was to do an app. However, having spoken to somebody in Swansea University, and then they put us in contact with WeAreQR to develop a QR code. With this QR code can then be put on our transfusion documentation and can be available then and there, so that it's easily accessible. And this is what it does. It will bring up an information hub poster, and then they're able to access the information that they require. This information hub poster can then go within clinical areas, if possible, especially outpatients departments, and it can be there at the point of need. Patients can also access that information before they go in for their consultation, and hopefully they will access information that they will be able to understand. This is an ongoing process. So obviously this isn't something that this is something that we're producing at the moment. So those posters will be available in the long run, but they're not currently available at the moment, but they will be. Okay, added value outcomes. So what else did we get out of doing this project? Well, we were able to establish, as part of this survey, another question that we asked was, would you be prepared to join our public or patient engagement panel? Because obviously we've got quite a few leaflets to produce. We've got 11 and we want to do them in co-production. So we had 11 members actually say that they would, out of 30 said that they would like to join the panel. So we have set up a patient and public engagement panel now within the Welsh Blood Service. Also our Health Our Voice project with People's First are doing this project, and this is looking at health profiles for people with learning disabilities. So we've been asked to participate in part of this project, really, in terms of providing information and making sure people have access from the learning disability community to patient information regarding blood transfusion that is easily understandable to them. Shared learning, well, basically what we're hoping to do is to share our learning as part of this project. So we're hoping to share it with our colleagues within collection services, donor side of the Welsh Blood Service, because currently what we do in the blood health team is we're hospital side. So we would really like to share it with our donor services side so that they can engage more people within, say, the learning disability community in order to become blood donors and things like that. So this is another thing that we're going to be working on in the future. Also, as part of the SABTO consent recommendations, they've got a project set up at the moment looking at a national standardised transfusion information leaflet. And that's part of our UK BTN network, our blood transfusion network. So our project is going to have a big impact on what is produced nationally and what is available throughout the UK. So that's something we're going to be taking on later on down the line as well. So in terms of challenges, our external influences, I'd say COVID-19 had a massive impact on what we were intending to do. And like I said, in terms of an engagement project, huge really. We didn't really know where to start. We had all these ideas set up for a forum group and to do some focus group work. That wasn't going to be able to be achieved. But however, thanks to our local health boards, we were able to put something out there and to have some good quality feedback. And again, in terms of engagement, engagement projects are always really difficult because you've got to find people that want to take part. It's about your time, your resources, and also having networks. And the one thing I will say about Bevan is that it does provide you with those networks, and it has been fantastic for that. So the next steps then, what we're going to do next, so we need to complete the next stage of this project. We need to set up the clinical review group with our clinicians. We need to look at co-productive review of the remaining 11 to 12 leaflets. We need to support shared decision making. As we've said, there were some health professionals that said they didn't feel confident because they were quite junior within their professions really. They didn't feel confident answering any questions that a patient potentially would have. So we're going to look at developing a clinical transfusion toolkit with further asked questions, preempting some of the stuff that might come up so that they're able to answer those questions. So it's providing that information for them. We're also going to develop a collaborative patient information strategy. And it's about increasing accessibility. One of the things this project has thrown up is that we do need to look at our web page. It's not as easily accessible within the hospital environment as it could be. So we're looking at producing a new web page. We're looking then at producing the integrated QR code. So the QR code that we've got that I showed you earlier will go on our Always transfusion record. So it is there at the point of need, and it is easily accessible then for clinicians or healthcare professionals to have those conversations to support informed consent with their patients. And also we're going to utilise our patient and public participation group to inform new technology and also the way we deliver our information going forward. So I'd like to thank the Bevan Commission. It has been a fantastic opportunity. We've really enjoyed it. What it's done for us is it's made us challenge ourselves to improve the way that we work. It's given us networks and information sharing, something that we wouldn't have had previously. It's provided those networks for us, which is built on our knowledge and our skills, especially in terms of projects and project management, and also access to knowledge and skills from other sectors, which you would normally have to pay a lot of money for. We've been able to access that, and that's been fantastic. And also it supported us to achieve the aims of this project and made it a successful project. So I would just like to finish off and say thank you, diolch, and special thank you to all our partners, the engagement leads within the local health boards who've worked together to help us to achieve our aims, and also our own Deb Underwood, our Blood Health Support Officer, for the analysis of the surveys. So thank you very much.